Have you been dealing with a persistent tendon, soft tissue, or repetitive strain injury that just isn't getting better no matter what you try? Does it stop you from running or exercise because of the pain? Is it making simple tasks like picking up a kettle, lifting grocery bags, or even working at the desk difficult? You may have tried resting, taking painkillers, seeing a physiotherapist or an osteopath, but still don't feel any better. Or perhaps you've already taken it a step further and had an injection, but that hasn't worked either. Understandably, you might be starting to worry that it's never going to get better. If this sounds like you, stay tuned for this video, as I'll be explaining what shockwave therapy is and how it might be the solution to help you finally get rid of chronic pain and back to doing what you love. Hi there, Sabrina here, Director and Osteopath at Fern Clinic in Hale, Altrincham. And today we're going to do a deep dive into what shockwave therapy is and how it can help with chronic tendon and soft tissue injuries. So shockwave therapy is also known as extracorporeal shockwave therapy, and you may have seen it abbreviated as ESWT for short. It uses high energy acoustic waves that are directed into the injured tissues to promote healing. Unlike a steroid injection or surgery, shockwave is completely non-invasive with minimal downtime and very few side effects. It's a highly effective treatment that's evidence-based and has been used to alleviate pain and promote healing in soft tissue, tendon, and even bone injuries. Shockwave has many studies that support its effectiveness, and these are for conditions like plantar fasciitis, shoulder tendon injuries, tennis or golfer's elbow, and even hip tendon problems like those seen in greater trochanteric pain syndrome. So you might be asking, how does shockwave actually work? Shockwave stimulates the body's natural healing process by improving blood flow to the area. It does so by increasing the formation of blood vessels, which is known as neovascularization. It also increases the cell metabolism for repair and desensitizes the nerve endings so that less pain is felt. It breaks down scar tissue and calcifications which can occur, and it also stimulates the production of new cells. So what can you expect when you come for your shockwave therapy session? We'll do an in-depth examination to find out what the injury is and the factors that have led up to it. If shockwave therapy is suitable, we start treatment on the same day. So at Fern Clinic, we believe that shockwave therapy is actually more effective when it's used as an adjunct to treatment rather than just a standalone therapy. So for that reason, we like to include the use of things like joint mobilizations, soft tissue techniques, TECAR therapy, and sometimes dry needling. We'll also provide a bespoke exercise and rehab program. And with this wholesome approach, most of our patients get out of pain and recover a lot faster. For most people, we do recommend one session a week for a total of 3 to 6 times. That usually gets you out of pain and back to your normal activities. But if your problem's been going on for longer than 3 months, you may just need a few more sessions. Shockwave therapy might be your solution if you have a chronic tendon or soft tissue injury that's been reoccurring for over 6 weeks. This can include an Achilles tendinopathy, a shoulder tendon problem like a rotator cuff tendinopathy, a hip or gluteal tendon injury, a knee tendon injury such as patellar tendinopathy or hamstring tendinopathy. You've got heel pain from plantar fasciitis, or you're struggling with a repetitive strain such as tennis or golfer's elbow. The pain stops you from exercising and is disturbing your sleep, and you've already tried physiotherapy, osteopathy or chiropractic, but it's not any better. You've had an injection, but the pain has come back, and now you just want to get to the root of the problem instead of masking it with painkillers. If you have any questions, just hit the button below to arrange a free phone consultation with one of our team, and we'll help you decide whether shockwave therapy might be suitable for you. Alternatively, you can just give us a call on 0161 706 0895 and we'll be happy to help.